anemic, there will be more chance of developing this disease. And also about the sexual this whether the patient is sexually active or not, whether the partner is having any infection or irritation like that, we had to ask. And also if we are giving medicine, try to give both partners, and also advise the patient to use any like the barrier methods of contraceptions during the treatment in order to prevent the recurrence. So if there is excess vaginal discharge, if the normal vaginal discharge is 40, if there is excess vaginal discharge is there, just the like the mucus type of discharge, but it is a little bit excess, that is only leucorrhea, then we can give medicines like musulikazad. Acne should be correct first. Excuse. Then we can give musulikazadi kashayam, padavladi kashayam, punarnavadi, pushyanakam. There also sravaharam, no? So pushyanakam churna with honey we can give. Shadavari kulam we can give, like Angayanam Kaishwarakulu. Even we can advise the patient to use a tribala kashayam as just to wash externally. Okay, that, or even advise the patient to do a sit swath in tribala kashayam, which also we can advise the patient so they can do it easily at home. So next is the candidal type of discharge. So if the patient tells you that have a thick curd like discharge, or if they are having a excess pruritus, excess itching is there, so there is kabam, no? So there is more dominant kabadosha is there. So we had to give like kabashamana type of treatment, the arakvatadi type of kashaya, where we can give arakvirasam, or even we can advise the patient to wash with the arakvatadi kashaya, or we can advise the patient to douche with the arakvatadi kashaya, or sometimes that will be burning sensation. And also if the patient is having candidiasis, check the fasting blood sugar also. So there will be an increased risk of pre-diabetic state or a diabetic state. There is an increased risk of developing this candidiasis. And also advise the patient to cut excess sugar and cut carb and all. So we can also give like krimic navadi nurkundiati, tribala gokulu. Tribala churna we can advise as labor externally. Or even if there is itching and all, we can advise the patient as sotamadi labor also we can give. So if there is a bacterial vaginosis, there will be a white discharge will be seen, but it is not like curdy type discharge. It will be more of creamy type of discharge. And one thing the patient will tell you, definitely the smell. Even before you asking, the patient will tell, smell is there, doctor, like that they will tell. So, and also it will increase after sexual intercourse also, this condition will increase. So in such type of condition, we can give this Arakutadi, Nimbadi, Kukulu Tiktan, Kashayam, Chandraprabha. So the Chandraprabha, Tribala, Kukulu, all are having like so anti-inflammatory type of action. Kanjanara Kukulu, Drakshadi Kashayam, which to correct the anemia and all. This, it also prevents a strava and all. And also you can give this Pushyanagam Churnam also. If she is not in a menstruating phase, you can give this Pushyanagam Churnam. Next is if you are doing an examination, there is swelling, severe swelling of the cervix. You can give like spots in the cervix, like inflammation, pain. Usually the cervix is like pink color, light baby pink color. If the cervix is like a angry looking like red shade with the dots in it, it's definitely a trichomonal infection. Sometimes the patient have like burning pain also. So in such cases, we can give like Kapha Pitta Shamana line of treatment is better. He will give you better results. So if Kapha is more, we can give Shadarana. If Pitta is more, we can opt for Sudarshana type of Sudarshana tablet. So Gugulatikta we can give Punarnavasho, Shodhaharam, Sravaharam. Such type of medicine will give you more results. So Trayandiadi, Guluchadi, Tiktagam, Gokshura Gokulu, Kaishwara Gokulu, Arogyavardhane Vadi. So at the end only you give Arogyavardhane in order to prevent the recurrence. So next, chlamydial infection also, there will be color. Uluchiadi, Padoladi, Amardotana, Brahatiadi Kashayam. Such type of medicines will give more result. And better to do douche treatment with even with tribella with you can give along with tribella a small stuttam is placed and then if you are doing a douche it will have more like to reduce the excess clear it will have more effect. Next is heavy bleeding. So sometimes the patient come to you with heavy bleeding, but there are so many underlying causes. So first, or it may be due to fibroid, it may be due to this endometrial thickness, endometrial hyperplasia, due to anovulation, or due to adenomyosis, due to endometriosis, or even due to PID. So if the patient come to you with heavy bleeding, our first aim is to stop the bleeding. So for that, we will give like Musalighadradi, Kushyanakam, Nekrodadi, Ashokavalkala Kshiravagam. And if the bleeding is prolonged bleeding, then we can give Tengambukladilehim, Shadavadi Kritam, Vasha Swarsam, the like Vasha leaves, Nadatora Vasikano, the Vasha leaves, which is it should be like put in a warm water, then it should be grounded and take juice like 1 to 2 teaspoon of juice with 1 to 2 teaspoon of honey. It will also having a very good stambana effect. And pravala basmam you can give like kudajarishtam is like it's also having a very good stambana effect, but it will induce constipation. So if the patient is having like bowel is okay, then you can opt for kudajarishtam or lodrasam you can give. So endometrial polyp is also one common, but I didn't get any good result for this endometrial polyp. So usually I advise if the patient is looking for fertility, then I advise to do an polypectomy. Usually I didn't get that much result, so I don't know about it. So usually the patient with only increased risk of developing this endometrial polyp. Next is menopause. Nowadays, we will get more cases related to menopause because people are more aware about the menopause related symptoms and all. So, as the life expectancy of women is increasing worldwide, there are more women in this menopausal period now. So, the women are having this more menopause related symptoms will be more. According to WHO, this absence of menstruation for more than 12 months, then only it is considered as menopause. So natural menopause means the menopause will like gradual cessation of menstruation for more than 12 months and then attaining we consider it as menopause. Surgical menopause means hysterectomy and all. So in surgical hysterectomy, we can the patient will have more menopause related symptoms like hot flushes and all. But in natural menopause, there is a gradual cessation of ovarian activity, no? So the patient may not have that much menopause related symptoms and all. So, as we all know, when the ovarian reserve is reduced during the time of birth of a girl child, there will be the ovarian follicle will be there. As the age advances, the follicle will be depleted and attaining the menopause. So the one of the most hallmark sign of menopause is the hot flashes. No, so hot flashes means a rapid, intense warmth. The patient usually tell that they are having like hot fumes coming from chest, neck and like in the region. So this episode usually lasts for 1 to 2 minutes, and the patient may have repeated attack of this hot flushes. So like some patients have 3 to 5 episodes even at night. So it affect their normal sleep and all. So in our classics, we all know the menopause yadi panjashada shame is the only direct reference for menopause, but there are scattered reference like we can consider it as ocean domainum and which are symptom which have the reference which mention about this hot flushes like the feeling of hot fumes from the neck and just like that symptoms in Dumine is mentioned. So the Nanadnica Vyadhi Pitta, these type of symptoms are mentioned. So for a lady with hot flushes, we can give like Ishtimadu Churnam in with 2 gram with milk, or even in Himalaya they are having Ishtimadu tablet. So Abhinga with Pindadailam, it's a kind of advice, Chandanasam, Shirasam, Draksharishtam, or Tungadrumadikeram for head. It is having a very good effect in reducing this type of symptoms and all. Then Shadavari Shirabhagam, or even all menopause related symptoms, we can give like Shadavari Shira Kashayam, like if they are having like burning pain or in the vagina and all, we can give Chandraprabha tablet. Belaguluchi Thailam for applying externally, Shirabella Thailam. So usually these type of medicines will give you good result in hot flashes. So if the patient is having more palpitation related symptoms, that is there more fluttering of the heartbeat, like if there is an increase of heartbeat for more than 7 to 15, in such type of patient usually it is better to exclude a cardiac cause. So you had to take an ECG, exclude any cardiac related issues, then advise the patient for like to give drakshadi kashayam, glujadi, sukumaran kashayam, Lakshmanarishtam or Partharishtam that we can give. Then sleep related issues, sleep, because normally the psychological, even the stress related issues, or even as a result of hot flushes, it may affect the sleep pattern in a menopausal woman. In such patients also you can advise like Shirodhara you can advise, or even the Tungadrumadi Keram for the head, or Abhingam with the Pindatail or Pitta Shamana line of treatment. Drakshadi Kashayam we can give. Or Shankapushpi, Shveda Shankapushpi Churna is easily available. Shveda Shankapushpi Churna, sorry, Shankapushpi Churnam is available. Shveda Shankapushpi Churnam is having more effect. If you are giving 1 to 2 gram of Shveda Shankapushpi Churnam along with milk at bed, it is having a very good effect to reduce stress and also the sleep related issues in menopausal lady. So next is osteo, like joint related issues like bone pain or even osteoarthritis or even osteoporosis related, especially in women with nowadays we can see ladies are attaining menopause in an early age like 46. Now we can see more premature ovarian failure cases are seen. So in such cases there is an increased risk of developing osteoporosis in the later age, because after menopause there is an increased loss of bone mass, like 3 to 5% of there will be loss of bone mass. So in the estrogen support the osteoblastic activity. That is, there is more deposition of calcium and phosphorus in the bone and all. So osteoclastic activity means after menopause, there is the reabsorption of calcium from the bone and all. So there is an increased risk of developing osteoporosis. So that way we can give such patient, we can advise the regular exercise and activity. It supports the osteoblastic activity. And also advise the calcium rich diet, then tikta shira kashayam, panchatikta shira vasti, vaishwantam chavana prashyam, pravala basmam, all support the normal to prevent the osteoporosis. Next is the urogenital symptoms. Urogenital symptoms means the patients are having like more of vulvovaginal, especially due to the deficiency of estrogen. There is more vaginal dryness will be there. There is trophic changes will be there, and the patient may have like if they are ever sexually active, they have burning pain after an introitus and intercourse and all. So in such patients, they will come to you with this burn line of treatment, and also we can advise some pichu, like this even with the Shadada Udakritam or Pitta Shamana type of medicines, we can apply as a pichu or as a labum into the vaginal cavity, or even we can give like Shadavari or like phytoestrogen type of diet we can advise. So next is cystosil. Usually in the perimenopausal period, the ladies are having like more of this, if the patient is like coughing or sneezing due to the prolapse, especially the laxity of the anterior vaginal wall, causing the prolapse of the bladder seal. So because of that, the patient are having, if even with the coughing or sneezing, there will be like bout of urine will become. So in such type of patient, it can be due to stress incontinence, either due to a prolonged labor, or even I had mentioned there because of the repeated DNC and all. There's an increased risk of developing the cystocele and rectocele, or sometimes during because in the postnatal period, if the lady is having constipation, if you are not taking care of constipation at that time, if you are not taking care of it, then there is weakness of the pelvic floor muscles, and which may later it may have the cystocele or rectocele related issues. So it's such type of such stress related incontinence. We, if the patient is having like a cough related or symptoms, we can advise
Hello, ma'am.
advice like P2 and the treatment we can advise like
Hello, ma'am.
uh,
There is a small lagging in the voice. Hello, ma'am. Just a minute. She is having some trouble with the internet. So we'll get back to the slides fast. This is clear. Your video is
okay,
having a
okay,
small lag. That's it. Okay.
okay, okay. So this Veshavaram preparation, we will buy some ajamamsa. That is ajamamsa. We can buy it from the market, like 200 gram boneless. We had to buy, and like guda sharkara we can buy, and then we had to melt it in water, and like in a boiled and reduced, and we had to strain it also to remove the impurities. But it's when it reaches to a one strain consistency, we can add this ajamamsam and also add kridam and trigadu. Trigadu Dadimatok, which is Yoni Dartik. So these we had to made it in the bolas. We can put in freezer and when take one portion and like warm it and make it a pichu ball. And after the douche and all, we can keep the pichu in the yoni bhagam, and it will help the patient to reduce the cystocele and also the uterine prolapse also if it is a first and second degree. And also we can like buy Mushika Thailam or Undura Thailam. We can buy also, we can like use it as a pichu. Even with Shadapushpa Churnam dipped in this Mushika Thailam, or even with Dhanundara Thailam we can or locally we can give the like the
Hello, ma'am.
Tribala Kashayam Shavanam, or even with plain Dhanundaram Thaila, which is dipped in the Shatapushpa, or even this in a cotton ball, we can advise. Hello, Dr. Radhika?
Yes, ma'am. There was a small lag. Now it is okay.
Okay, I don't know, there is a net issue. Just a second, doctor.
Okay, ma'am.
Is my voice clear now?
Yes, yes.
Shall I continue? Okay, Kegel's exercise also we had to advise the patient from the postnatal period itself. We can advise the patient to do Kegel's exercise, and also internally we can give this Dhanandaram Kashayam or even Gandharvastadi Kashayam with Ksheerabalavarti capsule or even drops we can advise. It is also having a very good effect in this cystocele or in first or second degree prolapse. Then Sukumara Grutam we can give, Shadapushpa Kalkam, Pichu, or even Shadapushpa internally we can give. So the menopausal related symptoms, there are more menopausal related symptoms are there. 11 usually 11 menopausal related symptoms are there. So usually patient will complain to you about the hot flushes, the mood swings, sleep related problems, but they won't tell you about the psychological related symptoms. But in India, there is more psychological related symptoms are more for the menopausal related symptoms. The sexual problems will be there, bladder issues will be there. Usually there will be loss of libido will be there, or the vaginal dryness will be there because of the severe burning pain and all. it affects their sexual life and all. Sometimes nowadays patient come to you claiming about the cure for this burning pain, especially in the menopausal period. So, for any gynecological disease, especially with this vaginal discharge and all, a speculum examination is, or a per speculum examination, abdominal examination, you should try to do this, especially with the discharge and all. If the patient complains discharge, just try to do a speculum examination to see how healthy the cervix is. And also with the speculum, we can advise a douche and all, like retained douche with speculum inserted. You can add tribala kashayam, just hold it for 1 or 2 minutes, then drain the kashayam. So it will be more easy. The cervix will be more like healthy within 1 or 2 days. You can see the change, like retained douche if you're practicing. So we had to do all the necessary investigation regarding the gynecological condition. So if there is a discharge and all, sometimes you in an ultrasonographically we can see the Nemotian cyst. Nemotian cyst means there is a previous cervical infection. As a result of the previous cervical infection, the Nemotian cyst is formed. So we can give medicines for that and also do a per vaginal examination to see whether the discharge is okay, the cervix is healthy or not. If you feel the cervix is unhealthy, go for a pap smear test. So this is one finding. You can see the kissing ovaries, because the both the ovaries are having this large cyst, and the ovaries is adherent at the back side, and the both ovaries comes nearby. So this condition is known as kissing ovaries. So next thing, when you're doing a USG, you can see the endometrial thickness. You can see when you next time when you see a ultrasonographically, so ultrasonography, you just look about the endometrial thickness. So endometrial thickness should be minimum 8 millimeter should be there, then only the normal reading will be there. If the endometrial thickness is more, then will be endometrial hyperplasia will be there. Next is this ultrasound of an this PCOS. Here it is mentioned as Steen-Leventhal syndrome. Sometimes they will write it like this only, Steen-Leventhal syndrome only. No, they will not write PCOS. So follicular study also you can do to evaluate the ovulation and all. So when the endometrial, so when sorry when the follicular size is more than 20 millimeter, the follicles will usually rupture. And you can also check the endometrial thickness side by side. And if the ovulation happens, there will be fluid in the pouch of Douglas. So if the follicles is growing properly and if it is not rupturing, you can give like this Jivaristam. It will help to rupture the follicle. And also you can give a Mrudu Virejanam. Then also it will be helpful. Or even give Sukumara Erandam soft gel capsule or Leshuna tablet. It will all, when the follicles is grown properly, if it is not rupturing, we can try these medicines. So even if a patient comes to you with a simple dysmenorrhea, try to exclude all the underlying pathologies, or amenorrhea or absence of menstruation in a sexually active or a reproductive aged lady. Always think about pregnancy, exclude that also before giving medicine to induce menstruation, and do all necessary investigation, and possibly try to do a pelvic examination, abdominal examination, or bimanual examination. Treat the cause, not the symptom. Treat the cause, underlying cause, and always try to be a conservative approach to your patient, especially your regionum. Okay, then they will maximum give publicity to your practice. Okay, thank you all for your patient listening, and I'm really sorry for the network issue.
Thank you so much, madam. It was a wonderful session. You have in detail explained all the gynecological issues that we face in our day to day life. Thank you so much for this session, ma'am. So, can we go for the question answers?